Hi, and welcome back to the Mom and Mind podcast. I am very delighted to bring you this episode with Dr. Meyleen Velasquez. We are talking today about a really, really important topic that is mostly geared towards therapists, perinatal mental health providers, infant mental health providers, and play therapists, and the importance of bringing those fields closer together, and more importantly, using cultural humility and moving towards being an anti-oppressive practitioner. We're going to dive into a lot of that, what all of that means, and why it's so important for us to be able to take some time and reflect as we're working with the families that we work with, to be able to see how we're showing up and what biases we might be holding, how we might be responding to the people that we're trying to help. And as you'll hear in this discussion with Meyleen, just how important this conversation is, but also how important that work is for us to do as providers, as helpers and healers. Meyleen is an immigrant Latinx psychotherapist specializing perinatal and infant mental health, and she has a doctorate in social work. And she focused her research on anti-racist and anti-oppressive mental health services. She is a brown woman living with vitiligo, and she's the author of What Therapists Need to Know About Perinatal and Early Relational Health, a guide to anti-oppressive counseling with caregivers, babies, and young children. Meyleen sits on the board of the Alliance for Advancement of Infant Mental Health and has served as the chair for the Florida chapter of Postpartum Support International and as a past president of the Florida Association for Play Therapy. And you'll hear in our discussion how she has beautifully combined all of her areas of specialty into this much needed book. So let's meet Meyleen. Welcome back, Meyleen. I'm so happy that you're here with us.
I'm excited to be here. Thank you for inviting me.
Absolutely. I'm just so in awe of the work that you do and the important gaps that you are bridging in this field and in infant mental health, and in the ways that you um, really see the need and are trying to kind of bring some remedy to the need within these specialties, and cultural humility and bringing depth of understanding and all of that to this field. It's so needed. Um, so that's what we're going to talk about today. And I'm happy for people to be able to hear our conversation.
I'm excited about it.
Yeah, so I want to start first with understanding a little bit more about infant mental health, and what that field is and why it's important.
Yeah. Yeah. Thank you for that. So